Everyone, did you hear me? Do you hear me?
Yes,
Yes.
Mayor.
Okay, thank you. Good afternoon, everyone. And today it's April 14, 2020, and we call for a virtual emergency council meeting. We're about to start. Madam Clerk, can you do roll call, please?
Councilman Galvin,
Here.
Vice Mayor Desilme, Vice Mayor Desilme, your mic is muted.
I'm here.
Okay.
Councilwoman Keys,
Here.
Councilwoman Estimate Irvin,
Present.
Mayor Bienaime.
Yeah. Please.
Mayor, you have a quorum to proceed.
Thank you. Thank you very much. And the first, are we going to have an update from the coronavirus COVID-19 by the interim city manager, Arthur Sole, and emergency manager, Angelo Branson?
Yes, sir. Thank you guys again for the quorum. And then I know as I just like to start off with, I think we pretty much worked out all of our bugs with doing these meetings online. I watched the last meeting on Channel 77 and everything went well. The CRA meeting, I was watching that online, everything went well. And again, our next meeting will be, we will be able to vote at the next meeting. I know I spoke to all of you guys about the timing of this meeting, and I didn't have time from last meeting to this one to advertise, to meet the Herald advertisement like we normally do. So this will be the last meeting that we won't have the advertisement in the full voting power. We'll be ready to go at the next council meeting. We're actually working on preparing the agenda moving forward. With that being said, I'm gonna just briefly say, since our last meeting, only change that we have as far as, the Corona update from myself is we did implement, as all of you know, the mandatory face coverings throughout the city for anybody going into any public facilities or anything. That's the one change that we did make the police chief along with code enforcement are monitoring the city. They're going out at night. I believe we had one business owner that we've warned about 3 times, and I believe he was arrested for not doing the right thing and moving forward. So I like to commend the Police Chief Jariga and Crystal Cordo for their hard work and moving this agenda forward to keeping our residents safe. With that being said, I'm going to turn it over to Commander Brinson for him to give us a brief update on some changing with the numbers and what's changing in North Miami in regards to the coronavirus. Commander Brinson.
He's connecting.
No,
He's coming on.
He's coming on? Okay.
We have to disconnect.
Oh, okay.
What?
You there, Commander? Okay.
So I just.
Well, let's, Mayor, if you may, can we proceed to item number 3? Back to Commander Brinson later on in the meeting.
Before we move forward and talk about those items, and since the residents won't be able to ask questions about every single item, can we hear what the comments are before we move forward with Madam Clerk. Madam Clerk, are you there?
Yes, Mayor.
How many comments did you receive from the public, from the residents?
We have 5 comments that were submitted via email. We did not receive any by voicemail.
Okay, can you do that right now so we know exactly what the residents are thinking?
Yes, Mayor.
The comments, yes, go ahead.
On 1935 South Hibiscus Drive, North Miami, Florida, 33181. I am so impressed with the food distribution the city is doing. More planned intervention will help our residents. Regarding utility bills, perhaps remove the fee for paying the bill online, parentheses, assuming it is still there. This way, folks that are inclined to pay can do so easily and revenue is coming in. Put a 90-day hold on disconnecting water and eliminate late fees while you figure out a game plan. Parentheses, that is what the county is doing to the best of my understanding. If you are going to consider anything specific to the water/utility bill, perhaps consider a base credit for everyone across the city. This way, you know exactly how much you are taking out of reserves and you can decide if you can afford to repeat it in the future. Otherwise, I would hope you address, if you reduce water bills by 50%, what is the cost to the city? For how long will the reduction be? If pulling from a contingency fund, what will you do when that runs out, and what were you creating a contingency fund for in the first place? Does this include apartment buildings? Is it water and sewer? All fees that are not waste, garbage, recycling pickup? Does it apply to homes with a second meter used for watering lawns? Is there a code in the system for the water department billing system to be able to tell one from the other if/when a reduction is made? What about residents already in arrears? If you chose to include waste, then we have the issue that the city has to still pay waste pros. Same questions as above. Reducing the water bill does nothing for most renters and reverses any movement toward conservation. Do unpaid water bills become a lien against the home when the owner sells it? A lien that has to be paid back? Money the city could use in the future? Another option might the city come up with a simple application for folks to apply for a reduced bill versus reducing everyone? Other ideas on how to help residents rebuild their lives. 1, summer camp. Perhaps having more of them, parentheses, I believe they are usually full. Other fee waivers for struggling families. These same fee waivers could be used during the next school year for after-school recreation programs and school break camps. 2, teenagers that are too old for camp. Programs/internships/work programs. Miami-Dade County Public Schools is seriously concerned about regression. Are there educational programs the library can be running during the summer? 3, Councilman Galvin's reference to Victory Gardens starting late summer, a series of workshops at the library on home vegetable/fruit gardens run by a professional. Muriel Olivares ran our community garden program before. Consider straw bales gardening. This is super easy, or food forest. If you have yet to see the 2 food forests at W.J. Bryant, you are missing out. These are permanent and produce food year-round. The city could provide eligible residents with all of these materials. And I'll stop there because the timer has run out.
What do you mean?
So residents were asked when they're submitting comments to keep it to the 3-minute mark.
Okay.
I stopped reading at 3 minutes.
Okay. Can you go to the next one?
Yes. Veronica Guzman, 540 Northwest 127th Street. There are 2 points I would like to address. 1, I do not feel comfortable with the city manager or interim city manager being able to make decisions on the city's behalf without input from the board or even public opinion. Something needs to be done regarding rewording that ordinance and specifying what exactly can be done, as giving carte blanche to do anything has not always worked out in our best interest. Not too long ago, we became entangled in a costly decision made by the former city manager that we will be paying for the next 14 years. Does anyone remember about Red Garden and the Super Bowl party? And the Super Bowl. 2, I agree with Councilman Galvin, as I think something should be done regarding to assist residents during this trying time. Many have lost their jobs and are struggling to even keep a roof over their heads. They shouldn't have to decide between paying their mortgage or rent versus their water bill. With an increase of water and electrical usage during this time, as most residents are now home and constant cleaning is encouraged, assistance offered in this area will continue thanks to the city for the informative emails and to the police department for their hard work during all of this. Thank you.
Yes. Which-
1100.
Hold on.
We're getting a lot of feedback.
Is it people on the front maybe?
I'm going back to mute.
Muted.
100.
Yes, go down.
It's Major Brinson that joined.
Oh. Madam Clerk, wait.
All right, Judy Brown, 1100 Northwest 128th Terrace, Sunkist Grove. Good evening, Council. My question is, once the COVID-19 virus curve has flattened enough for the city to return to some sense of normalcy, will the city of North Miami follow the guidelines that will be established by the mayor of Miami-Dade? Or will the city put together a committee headed by our emergency manager to decide how the city will return to normalcy? For example, will city employee have their temperature taken daily to enter the workplace? Jim Garrett, speaking on behalf of my mother, Minnie Sue Hendricks, a 48-year resident of the city of North Miami from March 15, 1972, residing at 645 Northwest 132nd Street, North Miami, Florida 33168, where she has lived since February 1st, 1976. To whom it may concern, here are my recommendations for improving our meetings, including future emergency meetings of our city council. 1. Read the comments at the beginning of today's meeting instead of after the meeting or the end of our meeting, so it allows each person's question on the agenda to be answered during the meeting by any fair, civil, and decent remark from any council member and/or city administrator during the meeting. 2, for future meetings, let's investigate and research a possible method to allow for an actual open public and discussion by civil and decent tone with 3-minute time limit by the general public via telephone dial. We must leverage and use technology to ensure public funds and public decisions are being implemented by everyone input. The mayor can still have control of the gavel from the public. However, it can be done electronically via telephone and internet with lineup of speakers on the side, just like Council Member Scott Galvin's town hall meeting. For your reference, Mr. Galvin has two-way communication in his meetings. May we implemented a daily news conference update of the coronavirus from the city council and city administration, consisting of the mayor and one rotating member of the city council, the interim city manager, the emergency management services director, and the police chief, in providing a daily progress report on the following subject. How many people are affected by the coronavirus who are residents of North Miami? How many people have passed away from this deadly virus who are residents of North Miami? How many people are hospitalized from this virus who are residents of North Miami? How many people are fully recovered from this virus who are residents of North Miami? How many police calls that the police department are receiving during 24-hour daily time period, parentheses, your choice, daily update? How many police calls are addressing following concerns? Number of daily violations of state, county, and city emergency orders regarding the virus crisis. Number of alleged domestic violence calls on a daily basis. Number of alleged child abuse calls on a daily basis. Number of potential mental health crisis cases on a daily basis. My intention is for our police department to focus their manpower and limited resources toward preserving the public safety of all residents and businesses in our city. At this time, our police department cannot address every social issue dealing with food distribution and/or recreation at this time during this virus crisis. I do hope these suggestions are taking into serious considerations by these public servants addressed above, and I do hope my comments are read and entered into the public record of our city. Our last comment, Claude L.C. Mancuso, 2500 Hollandale Beach Boulevard, Suite 506, Hollandale, Florida, 33009. Hello, since most Haitians living in North Miami are watching IAC TV channel 8.5, can this meeting be aired on this channel? And that is it for public comment.
Thank you. Did you unmute everybody?
I am unmuting everyone now. And again, everyone was just muted because of the feedback.
Okay.
And those who remain muted are self-muted.
Angelo Benson is the emergency manager is here now.
Going to cue him in.
Yes, sir, I'm here now.
Okay. Can we hear your update?
Yes, it's saying that there's a limit on the webcam. Can everyone hear me?
Try now, Commander Brinson.
Yeah.
Yeah.
I hear.
Go ahead, Brinson. We can hear you.
Okay. Commander Brinson, Emergency Manager for the City of North Miami. Just as a brief update, this information comes from the Florida Health Department, was updated as of 10 a.m. this morning. As of this morning, the total cases of COVID-19 in Florida are 21,367. Right now, there's a total of 2,909 individuals who are hospitalized due to COVID-19. Unfortunately, the total number of deaths in the state of Florida at this time is 524. Florida has tested 204,138, and 181,813 have come back negative, and that leaves us with those total positive cases of 21,367. North Miami currently has 95 confirmed cases of COVID, and just as a comparison, North Miami Beach has a total of 157 cases confirmed COVID-19. That's all I have at this time. Is there any other questions?
Thank you very much. And anybody has a question for Brinson? No? Yeah, and Councilman Galvin.
Thank you. It's not really a question, but I just think it's worth noting that even though there are approximately 95 cases reported, that number does not take into account those that may have already recovered. So it's, the state, unfortunately, is not tracking those who've recovered versus those who've been diagnosed. And it might seem alarming to say, wow, 95 cases in North Miami. In reality, that might be 70, 60, 50 or lower, because we just don't know.
That's correct. We've been building this case since they've been tracking it, and we've been receiving a lot of questions. I have been looking into getting more information, but at this time, the State Department, they aren't disclosing deaths per se and by city, as there are now reported cases by city. And you're correct, they aren't really tracking recoveries. That could be for a myriad of reasons, but as soon as we can get more updated information as far as recovery, I will include that information in the update.
Any other question? No? Can we move to item number 3, utility bill relief?
Yes. Through our conversations at the last emergency meeting, and through several of my conversations with members of the dais, you guys, everybody wants to talk about a possible utility relief program. So I had the finance director run a couple numbers. And it's a very brief presentation. If we want to do percentages, we do have a calculator. He has a calculator up on his screen that he can calculate the percentage and tell us how it is. One important thing to remember in this, and he will go through it in his presentation, is the utility bill consists of several aspects, not just water. So that's something important to remember. So it's not just the utility. You do affect some of the general fund revenue also with the utility bill. So at this time, I'll let, let's cue up Miguel to do his presentation on the screen.
You know, I can't see you guys. Can I see everybody? I don't see Miguel. I don't know.
I'm here. Miguel now?
No, I don't see him.
Are you able to see me now?
No, I hear you, but I only see all 5 council members.
Okay, you give me this presentation up there.
I don't have it.
Ricardo, are you working on the presentation?
Okay, go ahead. Huh?
Okay.
Yeah. You have the presentation?
I don't have it.
Ricardo has it.
Yeah, so he has to give you the screen.
Oh, there it is. Okay, so from discussions with the city manager, he wanted me to run a couple of scenarios just to see what numbers would look like if we were to do some sort of a credit to the utility bill with various fixed dollar amounts, as well as doing a possible percentage. So I've put together some quick numbers just so you can review as well. So next slide. Okay, so in performing our analysis, we're only looking at the in-city residential account. We're only considering those accounts for the credit. And there are approximately 9,710 accounts of those in-city residential accounts. And the typical bill is usually in the range of $250 to $300, but we're going to be using the calculation of $300 just because we expect most people will be at home, so there will be more consumption during this time period, as well as there'll be more people in the house at one time more than usual. So we're erring on that $300 number. Now, the $300 bill would consist of the county service fee, which is approximately 4%, sanitation, which is a fixed amount, so it would vary. It would not vary according to the consumption of the bill. The water and sewer would change depending on consumption, and as well as stormwater would not vary either. That would stay consistent regardless of the bill for residential on average. Next slide. Next slide.
Ricardo, next slide.
Okay, thank you. Okay, so we have 3 different scenarios. Scenario 1, if we were to do a $100 credit for all the residential customers, it would be approximately 33% of their bill, and the fiscal impact to the city would be $971,000. So pretty big number. That is if we're to grant the credit to every residential in-city account, $100 credit. Scenario 2 is a $75 credit to, and this is a quarterly bill, I should mention that as well. The $300 bill is a quarterly bill. So if we were to do a $75 credit to the utility bill, it would be approximately 25% of the bill, and the fiscal impact to the city would be $728,000. And scenario 3, $50, essentially half of the $100 credit, so the impact to the city would be $485,000, $500,000. Now those are hefty numbers considering the uncertainty that we have going forward. Essentially, this is the only steady revenue we have coming in that we, if people can continue to pay their bills on time for the consumption, that would be something that can keep us going. There's uncertainty, of course, because of the state revenues, especially. Those amounts are primarily sales taxes, and given the economic slowdown, there will be a very definite impact in the coming months with respect to those revenue types, as well as the revenues we get from parks and so on and so forth. So I would hesitate to think to move forward with doing this program just yet. If anything, we would want to do it in a way that would have people applying if they need it, as opposed to just doing a blanket credit, because the impact to the city could, especially in these lean times, could be consequential. So with that, I turn it back to Jay.
Mr. Mayor, if I may, we did something similar, and I think everybody up there was on the dais at the time. We did something similar. Through our conversations and doing the research, it kind of triggered. I was like, we did something like this before, and we were able to find it. Back in 2016, July 2016, if you guys can recall, we had problems where we weren't sending out the water bills. And we went for almost a full year without sending water bills to individuals, and everybody got backed up on their water bills. And Vice Mayor Alex DeSome, who coincidentally was the vice mayor at the same time back then, sponsored an item to give everybody a $20 credit on their water bill. So we did do this. We've done this once before. Now, what happened the last time when we did the $20, and I went and got the info with finance, you had to come in and apply for the credit when we did it the last time. Out of the 9,700, 4,264 people came in and applied for the credit. That dollar amount equated to approximately $85,280 that the utility took as a hit. If we would have just did it carte blanche across the board, it would have been $194,620. So we saved a little over $100,000. We saved more than $100,000 for people who didn't need the credit or didn't come in to apply for the credit. In this situation, as you did hear the finance director, right now we're not turning individuals' water off when they are over on their bills and they're not paying. We're not turning the water off right now. Our staff's recommendation is, if we are going to move forward with this, that people have to come in and apply for the credit. And the only reason I say so is, maybe I look at the numbers, say we're going to do the $485,000, the $50 credit. Well, everybody might not need it. So that person who really does need it, who has that bill is higher than the normal $300, that has a $450 bill because they have many individuals in the home, then maybe they could get a little more because we're not expecting everybody to come in and get it, to take advantage of the refund. So we have different, parts of our community where individuals might not need it. So with that being said, I'll turn it over to you guys for the discussion. I would, my part. Two important things that I would like to point out. In our budget this fiscal year, our capital projects reserve that we had in the water and sewer department was approximately $7.7 million in our capital projects reserve. We have not used any of that money to date. The fund reserve also for water and sewer is approximately $3.8 million. So we're talking about $11 million that we have in fund reserve that's sitting in the water and sewer account, which is not a lot of money. At one point, the city was we had about $30 million in our fund reserves. However, we've been doing a lot of capital projects of late, and we haven't increased the fees of late. Again, I'm not saying that we shouldn't provide any relief. I'm not saying that. I'm just trying to give you guys, give you the full picture of what we're dealing with and what we have here and what we see. With that being said, I'll turn it over to you guys for the discussion. Thank you.
Thank you very much. And you want to speak on the item first? Vice Mayor Desulme.
Thank you, Mr. Mayor. first, when the city manager mentioned, I remember in 2016 when we did have a very lively discussion regarding that $20. At that time, I felt that the way that we were going at it was the wrong way. A lot of folks did not know about the program, and the way it was promoted was not certainly a way that we could count on this time around. However, it worked pretty well because a lot of people were thankful for the $20, and some folks thought that it was too little, or whatever the case may be. But now we're in a pandemic, we're in a different time, and we don't have money. So we need to play a balancing act of helping as much as we can. The other thing we got to keep in mind, we don't know how long this era going to be. So whatever that we're thinking of doing, we need to kind of, think about it in a strong, longer strategic plan, because we don't know the effect that's going to happen as a result of what's happening now. So I would caution my colleagues to, let's think about a plan, but let's strategically think about the longer impact. The manager, acting manager is correct. There may not be people who may need this. However, from that 4,500 people that mentioned in 2016, out of the 97, I think we're going to be close to 8,000 or more, because right now this is a different different beast. So I would again ask the finance department as well as the manager, the water fund program that we started in 2016. We were supposed to months ago create a way residents could donate, businesses could donate. And I think the manager, we had a conversation last night regarding text messages. I know Miami Beach have a very, very effective program. And talking to someone, it kind of mirror what we have, but a lot of the residents prior to this has been giving. So they got a whole bunch of money going into this fund. So I think this is a way of also encouraging folks, either sending the reminder with the bills. Maybe this is not the right time, but it should have been done way before, because the former manager and I, we talked about this, how finance could look at ways to build up our emergency fund, not knowing something like this would have happened. The concert that we had, certainly something decent come in, but not to this extent. So I would, again, just say, please see what we can do, Mr. Manager, to, as creative as we can be, promote giving into this fund in the purpose of it. And I'm looking forward to see what my colleagues would come up with as far as recommendation into helping our residents. But just keep in mind, it's a much longer assistance, and it's going to impact us a lot. Thank you.
Thank you very much. Want to intervene?
Thank you. Through you to the manager, is the proposal that you've just shown, and now for everybody's information, this is the first time council is seeing this. This isn't a package that we received ahead of time. We are seeing it live like everybody else in the city. Is this recommendation, this cost, is it for the current quarter? Like, what time period does it cover?
Very good question, Councilman. Well, as you know, we're on quarterly billing. So we can drill down to say that we'll give a credit for the month of March or the month of April. We can drill down to that. Regardless, it's a credit on their bills. Some people won't see it right now. Nobody will see the impact of what their bill that is coming up on their quarterly bill. It will be the next bill that people will that they'll experience that will be the Corona bill where I've lost my job, and then that's the next bill. We can do it either way. We do monitor the billing on a monthly basis, so we can apply, hey, during the month of March and April, we're going to do $50 for March, or we're going to do $50 for April. We do $100 for March. We can do it whichever way you guys choose to. You just give us the dollar amount, and then we'll apply it accordingly. It's important. I want to go on the record to say that slide that we did show that had the water portion of the bill. That is the portion that we will be addressing. So we will address the water portion of the bill. We won't go into the sanitation portion. It will be the water portion. Now, if a single individual living in a home, their water portion of their bill might not be $100, if that's the number. Might not be $75. I think the bill that was on the screen was $74. So if you did a payment of $100, okay, they'll get the credit right there of $100 credit to the account, but 75 will go to that portion. Then the next bill will be 25 to that water portion. We are not, again, I'm not going to go into the general fund and mess with the solid waste portion of it. We do have some general fund challenges, and I'm trying to stay away from going to the general fund for that. So whichever way you want to do it, Councilman, we can do it.
Yes, sir.
Follow-up question. You said we have approximately $11 million in the sewer reserve?
Water and sewer. Water and sewer accounts.
Reserve. Okay, so that.
However, if I may, before you, 7.7 million capital projects reserve. As all of you know, we had several years ago, we had the CIF money. We were collecting money specifically for capital improvement projects. This is capital improvement projects. It can only be spent on capital improvement projects. That CIF money, which is the $7.7 million.
So if this situation could play out for another 6 months. If we approve a discount right now, and we have to do the same in, 3 months or whatever, where will that money come from?
Well, I will say it will come either from the fund reserve and water and sewer, or it will come from our general fund reserve.
From my standpoint, we have reserves, we have contingencies, they're there for emergencies. In my opinion, this is likely the biggest emergency the city will face for a long time. So, I don't want to hold back money that could be used to assist because we're saving it for an emergency. The emergency's here.
Yes, and the one thing, I agree with you, Councilman Galvin, but cautiously, we are tiptoeing upon hurricane season as well.
Yeah, but if you're going to die between now and then, or your family's going to starve between now and June, I'd say leave some branches in the streets. I mean,
you're absolutely right, sir. You're absolutely right.
I can't equate this to hurricane debris removal. We spent, what was it, like $5 million removing debris with the last big hurricane?
Yes, sir. I got to understand.
That's all, Mr. Mayor.
And Mr. City Manager, you said we have $7 million in reserve, right? What are you talking about?
Capital project reserve. In the water and sewer, accounts.
Okay, the enterprise fund, right? Right?
Yes, sir.
You're talking about the enterprise fund.
Yes. Are we unmuted? Yes, we're talking about the enterprise fund, sir. Yes.
Okay, and you said we have money in reserve for water, and those are for, okay. Yes, do you have any person want to speak? Councilwoman Estime Irvin?
Yes, thank you. If we obviously the will of the board from our last discussion is that I think most of us are interested in giving some relief. There are dollars that are coming on the federal levels to help out municipalities. If we do this, are these funds reimbursable?
Which money you talking about coming from the federal government? Madam Councilwoman estimate.
Based on emails that I've received, and my understanding is that there are plans to have monies to come down to on the municipality level. What
plans are you talking about?
Okay, let me rephrase my question. Can these funds be reimbursable, Mr. City Manager?
I'm gonna have the exact answer. I'm gonna say no, not for water and sewer. Cutting the water and sewer bill. I'm gonna say no. I will do some more in-depth detail looking into it, but no. However,
Okay. I'm sorry. You're saying that these funds are not reimbursable? Is that what you're saying?
I do not believe so, ma'am.
Can we find out?
Yes, I'll definitely look into it.
Find out from where, from which money, from FEMA are you talking about? Or from the money that they're discussing at Congress? Which money are you talking about? Find out where.
I'm asking the city manager to find out wherever it is.
We listed the reimbursements. Councilwoman, I'm gonna check the presentation I did last week. We did last week for the federal lobbyists. It kind of listed out the reimbursable items as of right now. I'm gonna check. I have somebody going to grab it so I can look on there to give you a better answer right now and go over some of the reimbursable things.
Thank you. That will help. If we can get that answer, that would help me in making a decision or on what I'm proposing. I appreciate that. Thank you.
Do we have any other question? It's a discussion item. Do we have any other questions? Yes, Councilwoman Keys.
She's on mute.
Is she muted herself? She's still muted. You don't have a
Councilwoman Keys, if you are speaking, we are unable to hear you.
Councilwoman is having audio issues.
Yes.
We don't have a mute to do we?
No.
Go ahead, City Manager.
Councilwoman Esteban Irvin, I just spoke with the emergency manager also, and then I'm looking at the list of things that are possible, and the answer is no. It will not be reimbursable. There are some of the things that are listed: emergency operation costs, training specific to the declared event, disinfectant of eligible public facilities, technical assistance to state to governments, emergency medical treatment of affected persons, related medical facility and supplies, temporary medical facilities, use of specialized equipment, medical waste disposal, emergency medical transport. These are some of the things that are covered. One important thing that Commander Brinson just informed me of, a lot of this stuff that is listed It's going to be applied to municipalities or government organizations of over 500,000. So most likely something like this will go to the county. These type of some of these reimbursements that we're talking about. But so right now, my answer is going to be no. The relief on the utility is not going to be covered under this. If we are going to do it, we'll be doing it from our coffers.
Does that answer your question, Councilwoman Estimate? I can't hear you.
I heard the answer. Thank you.
Vice Mayor.
Mr. Mayor, the National League of Cities sent out an email, I think the Deputy Chief of Staff sent to requesting that we get engaged as much as we can in the next level of stimulus, because that's the only thing that's going to count of cities less than 500,000 people, which would be us. But it's very specific. It's nothing guaranteed. So please make sure you check your email and you fill out that survey, because they
Vice Mayor, we lost.
We lost you, Vice Mayor. There.
Vice Mayor, you may have some.
is this. Can you guys hear me?
Yeah.
Okay, I don't know which part that you guys didn't hear, but I'll wrap up saying that the League of Cities urgently need us to make sure, check the emails and go online and ask Congress to lobby on the second phase of the Stimulus Act, which would include on funding for us, for cities like us, and then we could talk about the different things that we need. However, Mr. Manager, in reference to the $7.7 million you mentioned, can that be that money, whatever that money is, can we use that money for, is it something that we can change in case of an emergency? Because right now, obviously there's no type of capital repair or anything going on. So what can happen if there's a real emergency that we do need to use that money? Is our attorney here?
Yeah.
And I don't know.
I'm sorry, what was the response?
He's here.
He's where?
I'm on the call.
At his
Take us off.
camera.
Okay, Mr. Attorney, that would be one of the area that I think we'll look up on you to see if need comes to because we don't know how long and how big this is gonna be. If the capital improvement money that we allocate for in a case of emergency, if it could be used for something relating to water or such as something relating to capital improvement with water.
Yeah, I guess we will look into that, sir.
Thank you.
Do you have any other question regarding that, or are we moving to the next item on the agenda? Councilman
Mayor,
Johnson?
give me a second to check to see whether Councilwoman Keys is able to communicate with us.
To hear communicate. In the meantime, Councilman Galvin?
Thank you. So I'm unclear, and since I now know Mr. Kazoa is on the call, are we able to vote today? Can y'all hear me?
I hear you. I don't know if
Yes.
the attorney can hear you.
Yes, this is related to the emergency meeting, so you can vote.
I'm sorry, can you say that again, please? I couldn't hear.
Yes, this is an emergency call for the purpose of voting on this issue.
Okay. So thank you. The question I then have is, what are we potentially voting on right now? Are we giving direction to staff for $50, $100?
What I'm asking, Mr. Mayor, I'm sorry for interrupting you, sir. What I'm asking for is for you guys to give me direction now, for me to go back with the amount that you're putting forth and have a resolution done, and present it at the next council meeting on exactly what we're going to do. As I stated at the very beginning, the resolution was done the last time because our code does kind of say that we're not supposed to waive this. So this will require us doing a resolution moving forward with exact details of what we're going to do. But I want to, again, once we do have the final numbers, to go ahead and do the complete study and let you guys know and present to the public for public comment and everything, the complete story behind what we're doing here with the discount or the rebate.
So do you want us to specify a dollar amount right now?
I would appreciate it.
Are we gonna do it on a case by case, or are we gonna do it across the board? Because understand that 50% of about 50% of the residents of the city live in apartments, and they will not be impacted by that. That's mean they don't pay water bill. That's mean that money gonna be given to the apartment owners. Is that correct, City Manager?
Very good point, sir. And that was one of our concerns, is an apartment complex where your water is included in your rent. Those persons who do need the relief, we can't guarantee that the apartment owner is going to give them that relief against their rent. That's one thing we can't guarantee.
And I already received emails from, I think Carol have two voice.
Councilwoman Keys, we're able to hear you. No, we can't. We've lost you. We can hear you.
Yeah, can you maybe take
But
the
you're
phone?
in and out. You're coming in and out, Councilwoman Keys.
Yeah, we
Yes.
can. Yes, then. Yeah,
Maybe we should sign out and just sign
that's
back
something
in.
that need to take in consideration, and because, and we already have issues with those apartments who already have outstanding bill with the city. Water bills. Yes, Carol. No. It's like
So, Mayor, I would definitely, and I said it in the beginning, I would prefer that people come in and apply for the credit. That's my recommend. If we are going to do this,
whatever we propose, you would like to see the people come in and ask for it.
Yes, sir.
Scott, yes. Scott or Alex?
So, oh, okay, I'm the one first. Mr. Sori, if this is supposed to be for people who only need it, how do we assess the need? Like me, if I live in a waterfront mansion and I show up at the door asking for the credit, how do you assess whether I really need it?
And we kind of had that conversation amongst ourselves with staff. And we said something like, okay, you'd have to show us that you filed for unemployment. You've done this, you've done that. But not necessarily, because right now we're probably, everybody, that works for the city at some point is going to have furlough days. So our individuals who do have a job that didn't get laid off, they got a reduction in pay. Do they need to come in and prove they got a reduction of pay? I think we try to go on the honor system, and anybody who is living in a waterfront property is going to actually take the time out of their day to come over and ask for the $50 credit to wait in the line or something along those sorts for the $50 credit. I just hoping people will understand that we're looking to help people in need, and if you don't need, then you don't apply for the credit. So I think right now we're going on the honor system, and we're all going to be good human beings moving forward.
Who else? Councilman Desulme, Vice Mayor Desulme.
I don't know what you mean. Councilman, Vice Mayor Desulme, it appears that you're muted.
No, I'm unmuted because of I thought Keys was speaking, so that's why I had mine unmuted. Can you hear me now? Yeah, I don't like the idea of people coming in, and especially I'm seeing the social distancing and whatever that needs to happen a little bit more. I don't know what the council is thinking of doing in terms of what we are, but let me make this suggestion, which I never thought that we really had a good foundation start on. I don't even think we actually kick off the emergency water utility program that we have. If that's the case, we want people to essentially do it case by case for people who really needs it. I would suggest that we fund the program that we already have in the application and whatever procedure that we already have of the folks who needs the help. If that's the way we want to vet people. If we're not vetting people, then I would suggest then we give whatever the amount that folks are saying instead of people coming in or, trying to apply for $50 or $100. So my recommendation would be we fund the existing program that we have, and we put the resolution that you will come back with would give us the guidelines. These are the amount. It could be more than $100 because there'll be guidelines, and the guidelines is going to be if it's low income, if it's people who lost their jobs, whatever we want that guidelines to be, then it's something that's more manageable. If it's not going to be like that, instead of 7,000 people coming to City Hall, I would suggest that we just give them a flat whatever and announce it, which I really don't think that would help as much as we thinking. So those would be my two recommendations. Either the program that we have, we give it more and then come up with a concrete plan on how these people, what are the criteria for them to get whatever the amount is. Because at one point, we were thinking about $200 per person per year. And that would be one-time credit. That would be based on a lot of things. So maybe we could do that and then just say, let's give, X number of dollars towards the emergency program we already have, such as other cities are doing, and let that runs like that, and people will know. If the constituent emailed us and we say apply for the program, you could do it online. It should be very accessible, not people going in. There's a line across the street. It should be extremely accessible, and social service should be involved, and make it people where if people who really needs it apply. And then if we set the criteria of $500,000, and if we know how many households that $500,000 could give, then we'll have a better idea. This is how we helping the folks. If not, let's just say we're giving everybody X number and call it a day versus then just people coming into City Hall. That's just my little opinion.
But you cannot say everybody. You're talking about commercial business, commercial.
No, not them. They said 99,715. I don't know that.
No.
Is that everybody?
You're talking about residential accounts only?
Residential, right? I think it's residential only.
And not including apartments.
I think, Mr. Mayor, for the apartments, we should really looking at something where we could help the rentee directly through another program, excluding them.
That's what I say. They don't pay water.
Give them a voucher of $50, from that money, whatever that money maybe through that program.
Okay. Do we have, City Manager? Do you have a clear vision of where we want to go, and you're gonna come back with a proposal?
I would like, if I may, Mayor, I hear what Councilman DeSombe is saying. I think we should, I would have liked you guys, I have all of my staff is on it. We've heard the conversation here today. I get that we want to do something for the residents. That's clear and evident right now that we want to do something for the residents. We will put something together to move forward and come with a resolution. I'll brief you guys all on it as we come forward, and we'll be ready to vote next meeting. One important thing I just want to say is we're in for the long haul. I don't think nobody thinks this is going to be over tomorrow. So we do have the time to work and get this right and to come up with our financial impact of what it's going to cost the city and how it's going to affect us moving forward. So I just would ask that you guys allow me to go back and make a complete plan. You guys have had the conversation. We understand. I think we all are kind of along the lines of, I think for me, I think I got a consensus that it needs to be people. We come up with a way for people to apply. And I think Councilman DeSombe is absolutely correct. We already have the guidelines established through the utility assistance program. We pull that and we do some tweaking to it, and we come back with a resolution off of that. And that's how the people apply. And maybe we do the same exact thing we were going to do. It runs through the nonprofit organization that we said we were going to do it through, which takes us out of it, and we get it done that way. So I'm with you, Councilman DeSombe, and Mayor, I'll ask that you give me some time, and I'll try to see if I can have it ready for the next meeting. But I will be in contact with everyone and move it forward.
Thank you. Are we clear on that? Where is Councilwoman?
She had to move to a different area in our house with a stronger Wi-Fi connection.
Okay.
I think Galvin wanted to say something, right?
Yes, Councilman Galvin.
I'm just giving a thumbs up to Alex because I think that's a great idea to run it through the program with the established guidelines instead of trying to recreate the wheel. And anything we can do to, keep social distancing and not have people come. Staff could be overloaded. I mean, think about it. You're going to do water bill relief. You're going to do COVID testing. You're going to do food distribution. There's only so much staff to go around, so lessen that impact.
Thank you very much. And can we move forward quickly with the next item, food distribution? Yes.
The next item is the food distribution. We put together a plan. The interim deputies put together a plan for us to move forward food distributions. It is our plan that we came up with something to do. We are definitely open to you guys tweaking the plan. So what she's going to present to you guys is our plan that we came up with. And then you guys let us know how you'd like to tweak the plan.
Quickly, please.
Quickly, good afternoon. We understand that the need is great for food assistance and that there's multiple ways in which we can serve our constituency. So the idea is that we're going to continue the food pantry, but it will be run by the city's social service department. Feeding South Florida will continue to provide the food at no cost. Albert, which is the director for the department, is working diligently to develop a plan to make sure that the operation is not interrupted and the transition is smooth. We are also working with Feeding South Florida that they provide food boxes or bags that are inclusive of items that are fairly easy to prepare. Our target audience with this will be our homebound seniors and disabled. The idea is that this will be delivered to the front porch of these individuals by our police department as well as our Parks and Recreation department. This is a model that is currently being implemented by a BSO and is successful so that we're able to assist those that cannot get out their homes. And lastly, we are moving forward with a weekly food distribution that will serve 600 vehicles weekly. The food will be supplied by Feeding South Florida. We will provide support by providing the police department and personnel to assist with the dry food distribution only. The area that we're looking to host this distribution would be the North Miami Public Library. The chief of police and myself are in communication with Feeding South Florida to make sure that we present a plan that is smooth. And these are the three approaches that we'll be taking to provide food assistance to our community. And that's it for me if you have any questions.
Everybody gone, it's only Scott.
We still have a quorum.
Since Scott and I are on here, I do want to say thank you to Councilman Galvin and those others who called Feeding South Florida in reference to the pantry. The thing that I want to stress out, and I don't know how we're going to do this, whatever that we do, we need to, and speaking to the president this week, he restated that we need as much data as possible. Because at the end of the day, us looking at the whoever's giving us money or funding or whatever the case is, it's good, but we need to find a way of how to capture the data. So I know you didn't mention this, but I am working with Albert to make sure that the pantry is running efficiently and to make sure that everyone, the number that we have will increase of folks from all over the city. And of course, we talked about the delivery. So with anything that we do, as much data we can collect, basic data in terms of who lost their job because of COVID, who has somebody who was infected in the house, whatever that we could do to assist these folks, or at least we get from the residents, they would like to know those data points, and I think it'll be very beneficial for us to know in what way and how we are helping out our residents. I do understand, is it my understanding the 600 will be open to the entire public or the entire world or something like that? Is that correct?
The weekly food distribution will be open to the public.
So what we need to do there, that however we do registration, we still need to register what city or zip code, whatever that we want to do that make it easier, because it's 600 cars that we know who's getting the service. We know we're going to do the pantry, that we could manage because those are our folks and we're not turning nobody away, but it's a much more secure place where we could manage who's coming in. However, with that 600, I would like for us to have some type of registration in however we may see that registration may be, so we will have data on it. Doesn't have to have names and contacts, but at least we know 500 cars comes in, you know, what are the 500 cars, et cetera, et cetera, et cetera, if we're really serving the need of our community versus, you know, and we don't mind helping, but we got needs here in North Miami, and I'm a very big component of us helping our folks here, and then we can move further abroad as we move forward.
Yes,
Thank
sir.
you.
Thank you very much. Do we have any comments about the food distribution, Councilman Galvin?
I was going to already thank Councilman DeSulme for being so adamant with Feeding South Florida that our residents benefit. The plan that we have in place now is far better than what they were suggesting 3 or 4 days ago. So thank you, Councilman.
Thank you. Do we have any other comments or person who want to talk? Because I can see everybody. Okay, are we done with that? And thank you very much for that.
So item number 5, I'm gonna, if I may, Councilwoman Esteve, if I may start with your item.
That's fine, thank you.
And the item is sponsored by Councilwoman Esteve Irvin. Item number 5, can we?
Yes. So, so the next item is the North Miami testing sites. I was directed by Councilwoman Esteve Irvin. She she had saw a nonprofit organization and asked me to look into the testing site that's happening over at Amelia Earhart Park. I did do the. It's in Hialeah, sir. Amelia Earhart Park is in Hialeah. I did send the police chief to go take a look at the testing site. So I will, give some follow-up after Councilwoman explains to you guys what it is that she is proposing that we do. But I will be I'll follow up with some of the answers to some of the questions after she's done. I like to give a couple statements on what we did look at and moving forward with the testing site. With that said, I'll turn it back over to Councilwoman Esther Merriman.
Okay, thank you so much. So in our last virtual meeting, we had a discussion and I brought up the fact that I thought I'm competing with Calfee. So I thought it would be a good idea to have a testing site, right?
Councilwoman Keys.
Go ahead. We're ready to go ahead, Councilwoman Esther.
Okay.
So I thought it would be great to have a testing site right here in our city, and the reason why I'm really strongly advocating for this is because, like I mentioned before, and this has been reported, that especially in the Black communities, there is a misconception that they are immune from getting this. On top of that, a lot of the sites are kind of far from us. Marlin Stadium, Hialeah, Marlin Stadium. The other one that's closer, I guess, would be the Hard Rock Stadium. But I think if it's right here in the heart of our community, that it would encourage more people to, first of all, get tested if they have the symptoms, and then to realize the importance of practicing the social distancing. On top of the fact that I asked our city manager to contact Allied Health. They contacted me to let me know that they would be providing free testing to the community. The testing, they would get the results within 24 to 48 hours. And they actually are supplying this testing in Hialeah themselves. So I asked our city manager to look at it to see if this is something that we could entertain as a city, so that we can have testing right here for primarily our residents here, so that they are able to test to see if they're to test, and also we can also determine if we have hotspots, etc. But I'll let you go into more details, Mr. City Manager.
So, in my research, I'll actually, I'll do in our research the site that we see that's most likely that we will be able to do it, and I'll ask Ricardo at this time to put the image on the screen for us. But the site that we would look at doing would be the Joe Celestine Center to do the site. And I'll have Chief, if you guys have any question on why that site, I'll have Chief speak about it. Matter of fact, can we unmute the Chief's microphone and he give us an overview of the site and the possibility? Unmute the Chief, Vanessa, so the Chief can speak.
Good afternoon, everyone. Chief Larry Juriga. Good to go?
Yes, go ahead with the site. The site's on the screen. Can you see it?
Yes, sir. Very good. Good afternoon, everyone. Chief Larry Juriga. As the manager was indicating, Pepper Park, just south of the Joe Celestine Center, would be the location we're looking at. I did meet out there with representatives from Testing Matters, along with Allied Health, who will be running not only the operation, but the testing of the samples. If you look at the map, you can see that that is the south side of Pepper Park, 135th Street, the roadway going east. We would block off the 2 lanes closest to Pepper Park, allowing 1 lane to travel through eastbound. And if you look just east of the open field, you'll see the first entrance. The first entrance will be where the testing participants will go. The first tent there, the blue triangle, the blue box with the white triangle, that's where we will confirm whether or not an appointment has been made, because this location will be appointment only. Then they'll proceed into 2 lanes. The next blue boxes, you'll see they'll obtain some additional information about the testing individuals. The next blue boxes you'll see is where they'll actually sign the documentation. And then the blue boxes just in the middle part underneath the Claude Pepper Park sign is where the testing will take place. They will never leave their vehicles, and we'll have two flows of traffic going through, and then they'll exit the parking area. According to the chief operating officer, it should take about 6 minutes from start to finish once the person pulls into the parking area. So initially they were advising they could probably get between 250 and 300 people done per day. It would take resources from the police department to set up. Additionally, we'd need resources involving a security company overnight to watch the equipment, and then of course the tents and different things like that.
With that being said, through the mayor, with that being said, we've put together some costs associated with it. The first cost I'm going to give you would be approximately $46,000, and this is for 3 weeks of testing. 3 weeks of testing. This is police staff. There is the majority of the cost, which is 4 officers and 1 supervisor. However, well, let me finish with that one. That's $46,000. That also includes the security company overnight to keep an eye on the facility, and it also includes about $5,300 worth of tent rentals. The individuals will use that first room when you come inside the Joe Celestine Center, the air-conditioned room, where they will store the kits after the person has been tested. Once 100 tests are come, somebody comes, picks those up, and moves forward and takes them to the lab. What happens is that we get results from our conversation with them. The results are given within, I believe it's between 12 and 48 hours. So it's a fairly quickly turnaround. The individual's called, and then they do get some counseling and some additional follow-up questions go on. Now, that $46,000, which is a hefty price, if we did change it, then we were only going to test 5 days a week, which I asked the chief to look into and get rid of the overtime costs. That price significantly dropped by about $20,000. So then we get to be about $26,000, and it gets a little more manageable. I just did that because of the cost. I want people to understand what the difference in the cost is. After that, I will say that's it. After I did speak with the individual, and I'll let Councilwoman do some more follow-up after I finish. The only question that I had was, how do I ensure that North Miami residents are tested? Is it by appointment only? It's an automated system. They were working on ways he told me they would look into, and I don't have that answer right now. And I might get it from him later on today after we finish this. Looking into some kind of ways to add another question in the artificial intelligence that answers your calls to try to narrow it down if they will be willing to do North Miami residents only, or to do a percentage of North Miami residents. So I'm waiting on the individual. He's supposed to get back with me when he does have that answer. Again, as eloquently put by Steve Zelkowicz, I'm not here to be an obstacle for testing in North Miami. I'm giving you guys the numbers that you guys would want to know. I felt this was what Councilwoman Estime Irvin asked me to do. We went through and did our research, and we've come back with it. It is a doable plan if this board so chooses to move forward with doing it. My only thing, what happens after the fact, that's not our specialty. So, Councilwoman, I think with that said, if you have anything else you want me to add, I'm willing to add, but that's what I have.
So I wanted to add, since this is COVID-19 related, the funding that would be for the police force and the security, would that be reimbursable?
That, I believe, will be reimbursable. Okay. And let me also add, I'm sorry, Councilwoman, this is not just our police. We do have a verbal commitment from a National Guard group that is here locally that they will assist in running the operation. They basically run the most of the operation. They will be running it, and then you have the people that do the testing. But the National Guard are the individuals that run it. If you guys do come to a consensus, this is something that we want to do, I have to send an official request. Matter of fact, I think it will have to be signed by the mayor, an official request to this organization for them to come forward and help us in doing the testing at our site. But through my preliminary conversations, it's not an issue. I just have to send an official request from the city.
Yes, Vice Mayor.
Thank you, Mr. Mayor. Mr. Manager, I heard your presentation, and I want to thank Councilwoman Irving for the initiative. On April 2nd, when I read in the Herald that City of Miami and Hialeah had their own municipal site, I was very intrigued. I did send an official letter, which you missed to mention, Mr. Manager. No, it's okay. I carbon copy you and Natasha, just out of transparent, to Senator Jason Pizzo, Dottie Joseph, and Commissioner Monestein to ask why, if they could do something to get our city a site. So I did not know about the municipal sites until Chief Jariga had mentioned it to me, and you and we had a conversation. So I do want to applaud you, Councilwoman Irving, for going that route, because I was texting and getting in touch with the state and the county to see what we could do. In terms of the folks who are coming in, I really don't care if it's one person that we were able to save. The things that we have done as a city, in terms of this is help, this is somebody's life. There's folks who are asymptomatic to this. It's the fact that if somebody do go and get tested, they are positive, they know they could be a little bit careful. So the seniors in our city, the folks who may not have the best immune system, this may be beneficial to them. So I would say I do encourage whichever amount that we want to do. I do like the 26K. And even if it wasn't refundable, Councilwoman Sterrell, I think this is one of the best things, as me being a big component on giving out.
You said,
I think you're a couple years
to former Councilwoman.
Estimate Irvin.
What did I say, Sterrell?
Councilwoman Sterrell, you know. I guess I should say hello, Councilwoman Sterrell. Thank you for the services.
Oh my God, Councilman Estimate Irvin, Mary Estimate Irving. As you know, I am in District 4, and she was my former councilwoman. So I do apologize by any means, and I didn't mean any harm by it. Again, so we are in a pandemic, so we're not thinking right. But with all the seriousness of it, yeah, we give out food, we give out stuff, and we just doing a big weekly distribution, giving out food. This is as equally important as the food that we are giving out, because the likelihood, the health of our city, that's going to talk about all these people paying their bills and doing all these things that we talked about. So I wish it was longer than 3 weeks, but hey, 3 weeks is better than nothing. I applaud you, your administration, Mr. Manager, Madame Estimate Irving, and all of my colleagues. I think this is worth supporting. I would ask Mr. Manager if you could reach out to Commissioner Monestein and see if they could give some money, even if it's $10,000. I did text the mayor of my one of our adjacent city, and they did say they are in talk with where they're going to partner, or there was some type of talk going on with Aventura, because Aventura just went on doing their own municipal testing as well. So, I don't know if
so the county can hold a site in Aventura, not the city.
No. I spoke to Commissioner Monestein yesterday. When I read it in the paper, I asked them, because I had sent a letter to them on April 2nd, Mr. Mayor, and he reassured me that it's Aventura, Hialeah, and Miami who are paying their own. The county was thinking about doing something using FIU or using, I think the old Costco, he stated, and he said that it's a long process and there's no guarantee. I did tell him that I had saw this was going to be on the agenda, and he said, please let him know. And Elizabeth from his office was on the call also when he reached out to me. So from my understanding, from what he said, it is the city that's doing it. And I text one of our adjacent city, say, do you want to partner with us? And the mayor had replied back saying that they are in talk with Aventura. So just so we know, it's not the county, because I had already jumped on him and Dottie said that it's probably the best way if we have the funds to do it ourselves and get it out the way. So I'm in fully support, Councilwoman Esther Irving.
But there is 2 steps I think that need to follow and a site. We're gonna be testing people. Now, if we find out that we have a high percentage of cases and we need to isolate people, what we are going to do now?
So I was made aware this week, and the city manager can attest to that we have, and I'm not saying this is the answer to it, but we have some dollars from HUD just for the purpose of assisting COVID-19 in terms of even for facilities for COVID events. So I am hoping that creatively.
I don't understand. Explain me exactly what you're talking about.
Mr. City Manager.
In case after testing we realize that there's a lot of people who've been tested that need to be isolated somewhere.
Yes, like I've mentioned, right. So like I've mentioned, I understand that we have some dollars, and hopefully with those dollars that we can figure out a plan on how to do that. Mr. City Manager, can you speak on the HUD and the dollars that I'm referring to, please?
Yes. We did receive an allocation from HUD, approximately, I think it's close to $480,000. I think it's somewhere around that amount that has come in regarding relief efforts from COVID-19. I'm not completely versed on what the dollars could be used for yet. I think I think the money just came in maybe last week, I'm sure, or maybe, I think it's last week. So I'm not positive yet, Councilwoman, on what it is exactly we can use the dollars for, but I will look into it immediately and determine what it is.
The question is, you're going to open a site, right? You're going to start testing people, and you have a case, someone is tested positive, right? And now when you're going to do your tracing, you have to isolate that person. Where are you going to put the person?
I don't have the answers, but I'm sure we can work things out. If someone has to be isolated, they're gonna, they should be isolated. If maybe family members will have to come and step in and take the other person if they're not tested positive themselves. Those are things that I guess we can work through the administration and work through those kinks.
What administration that's going to work on that?
Excuse me?
When we are doing something, we want to test in people. When you start having 200, 500, 700 people, and those people need to be isolated somewhere, where are you going to send them?
I think I understand. You have a valid question, Mr. Mayor, but I think is as equally, we'll have to work through those, but it is just as important to test.
Those contact tracing and isolation need to be worked together before you open the site. It's not after you open the site, you start testing people.
I disagree, respectfully disagree. I think you have a valid point. And I think that testing is extremely important, that people need to understand that. Not everyone, I spoke to a medical professional that I know, and I'm not a medical professional, but based on the information provided, 80% of the time that people are tested positive, they don't even have those symptoms. You know, so it is extremely, you know, we're talking about the asymptomatics, and what about the people that have those symptoms? They should know, we'll work it out somehow. But
when we know as a city, we are putting the testing side.
Right. So we are allowing, so this is the city making the facility available for someone. The city is not in the medical profession. We're just making it available so that there is a testing site, just like any other site. It's just closer to home.
Mr. Mayor, can I say?
Let's understand, we're gonna advertise it and ask people to go tested, to get tested. The result gonna come. They're gonna call them and they're gonna tell them that you are COVID-19 positive, right? And now, based on the questionnaire, that person need to be isolated, leave that house. What we're gonna do with it? That's when we're just gonna test it people, and then if we become a hotspot, and in the media we are a high spot, and that's it.
Mr. Mayor, if we are a hotspot, you wouldn't be concerned? Don't you think that we can then have?
What we're gonna do next? That's the question.
That we can have leverage to go to the governor, go get federal dollars for the help. If we are considered a hotspot, and if we are a hotspot, shouldn't we know that?
We are talking about an emergency plan, and all the aspects need to be taken consideration. Not just open a site.
Great, man. Can I say something, please? Are we speaking?
I'm listening. Go ahead.
Oh, okay. Well, one thing we got to keep in mind, this is something we have hundreds of cities who have already done it. So I don't think people are looking at us if they are.
Yeah, but you can go see they have hospital bed ready.
No. It's not. Let me say this.
They have that.
Yeah, but they have it for our people also. It's not only necessarily if you go and get tested. If one of our seniors right now, which I had a lot of seniors in my area, who I've sent to get tested. So this is a county issue. This is not us taking over the Department of Health or the CDC. Our job is not to mandate. Now, I was hopeful when this conversation started that we were being progressive as a city, thinking outside the box, which I think that cities should have been doing as far as what do they do with isolation. Perhaps we would, I thought we were going down, do we rent the hotel that's on 7th Avenue, that's not doing nothing. You could put patients there. That's something way beyond other cities are not doing. But again, before I make my point, Mr. Manager, please be in communication with us, because I was very taken back that I did not know about this funding source that came in. So you need to let us know these things, even if it's via email or a quick text. At least all of us would know. So going back to my point, I do not think the cities who are testing, and the manager could verify with city managers that they have a plan to isolate folks. I think China is the only country that could do that. Folks that I do know, I have personal families who have been tested positive, and they stay in their home. So you don't go anywhere. It's a matter of them knowing where they stay in their bedroom. And there's ways that you could treat people who are positive. Now, the best way of doing it is what, based on the protocol and the research that came out of China, where they do isolate folks. But you can't do that in this country to tell people this is where you go unless this is something massive. The governor did talk about doing something like that, but it only lasted one day. I don't know if there's any other cities, but we are a city that's just looking to test folks. It's not only city of Miami, North Miami residents that will be getting tested. Our job is just to provide the information, and folks will be careful in terms of the test. Now, if we want to talk about what we want to do with that $400,000 in terms of finding isolation for people who are, I will welcome that conversation, but I think it's two different conversations in terms of us providing the tests for the people. If they are positive, then they know to be isolated, to be in a room, in the house versus them, touching and talking to folks and maybe even going to work and until that quarantine period is over. And I think that the health department does, because we do have residents who are positive, they are being monitored by the health department once they are positive as far as the monitoring. So it's two different things, and I don't think we want to go down as far as what we do for the folks who are positive in terms of isolation.
Yes, Councilman Galvin.
Thanks. I think we're trying to recreate the wheel. There is already testing being done in a lot of other places of the county and country. Somebody should already have the answer for who's responsible for housing somebody if they test positive. Is the county right now paying for, and remember, hotels are closed. Is the county paying for X number of people who test positive to separate, or is that on the family? Legally, that's got to have already been established, and we should just contact somebody else who's already heading up testing and ask them how they handle that. Probably the answer is it's the responsibility of the person who got tested. And as long as we all agree that that's what it is whenever we adopt this, somebody shows up a month later and says, hey, give me a hotel room, I got sick. We can say it's not the responsibility of the city to do that for you. That's, sadly up to you to just go in a room and close the door.
Yes.
Mr. City Manager,
Yes.
can you please visit or speak to Hialeah, to the city of Miami and Aventura to see if they have situations like that? How many, is it a large percentage of people that encounter that? And I get that some of those cities are not exactly our makeup, but even if there's a situation, how is it handled? Again, colleagues, I find it to be a very important time. And I think, like Vice Mayor said, we'll be a very progressive city to advocate and to have this right here on our side, so that at least the majority, if not all of our residents that have the need and that want to be tested, that have the symptoms, can have that opportunity to do so. So on top of the fact that if you spend those dollars based on the information that the city manager said, they're reimbursable because of this act. So I'm proposing that we move forward with that.
I definitely will, Councilwoman. I'm sorry we haven't. I don't know what's going on with Councilwoman Keys, but I'm guessing you guys are leaning toward me moving forward and putting a plan together to move forward with this. Is that the consensus I'm getting from everyone? Simple nod of the head would be good.
Councilwoman Keys is reviewing.
I want to say, Vice Mayor, with respect to the HUD money, no, I didn't. And I normally, every time we get money in, I send the thing out telling everybody we got money in. However, remember my last report when I did the federal report, and I had the numbers we were getting from the federal government. It did say in HUD that we were going to get about $450,000 in. That was there, but we hadn't received it at that point, so I didn't send it out. And yeah, I didn't send it out. I apologize for that. I'll get it out.
It's not the letter that we received for the the money that we're going to be receiving for 2020. It's another money?
Yes, another money, sir. Yes.
Okay.
Yes, it was in the last, when we did the presentation with Clarence from Becker. We had outlined what our monies were going to be coming in from federal monies coming in response to COVID. And the CARES Act.
I never spoke to Clarence.
What you talking about?
Oh, you were on the
COVID?
Oh, okay. Then that's what.
I'm sorry.
Okay. So wait, did they get us that money, or did Becker get it, or this is just all cities?
part of our allocation, and when they broke the money down among cities.
Oh, okay, so they didn't get it, okay.
Are we done now with that, with item number 5? Are we moving to item number 6?
Councilman Galvin has something to
Councilman
say.
Thanks, I'll be quick. I want us to make sure, Mr. Manager, that we vet this company, whoever it is that's gonna run it, that we make sure they're not gonna run out of testing kits, they're not gonna run out of nurses, they're not gonna run out of anything. Because if it goes south on their end, we're the ones who are gonna be taking the blame. Also, I have a concern logistically with traffic around Celestin Center. I can envision where people are wrapped around the building, backed out to I-95. You know, that's a small
Appointment.
parking area to pull them through. Maybe we could look at also doing an ingress and egress on the north side parking lot as well. So you've got testing on the north side and on the south side to try to move it through. But I am concerned with traffic and, you know, creating a bottleneck what's in essentially a residential area.
Yes,
That's all I have.
and I work with Chief Jariga. He did go in and visit the last site, the site that's up at and he came back very confident that we could get it done with little impact to the community at that Joe Celestine site. But I will go back and we will finalize the plans on this moving forward. My goal is to try to have everything wrapped up in the next week and be ready to come back to you guys with a plan moving forward. I will talk to all of you guys individually on us moving forward with the plan and make sure that we get a consensus from everybody on the plan to move forward. Thank you, Councilwoman Estimate. I'll do what I need to do for you.
When would this start, Arthur? Because this is, I thought this would start on Monday. No?
I can work very hard to see how fast we can start. I'll speak with the individual. I know he told me they're ready to go. I think he said they're ready to go in a week's time. So let me reach out to him today, and I'll give each one of you a call and let you know the possibility.
They're going to cancel the one in Alea?
No, sir. They're ready to do an additional one. My only question, which I will, I'll ask the individual. I'll get back with you. Is the concern on weekends? Do we want to do the weekend testing, or do we want to just do during the week?
I would say during the week. That's $26K.
It's also reimbursable.
Yeah, but that's if
don't you say, city manager, there is an agreement that needs to be signed?
Yes, something that the mayor has to sign. Yes,
Okay.
that's to bring in the National Guard.
Thank you.
But wait.
Number 6?
No, I have a question regarding that, Mr. Mayor. Why do they need the National Guard?
That's who they that's who helps them run the site. They do the intake and the application, and they do all of that stuff. Yes, sir.
Okay.
And the state gonna pay for the National Guard, right?
Yes, sir. The one part, let me put on the record, the one part that I did not speak about is the meals. We're going to be required to provide meals for the individuals at the site, but everybody's been donating the meals. All of their other places have donated the meals. I'm sure that we could reach out to some of our partners and get the meals donated for the 3 weeks. So I'll be making a couple calls myself, and then also trying to lean on you guys with any connections you may have for us to get meals donated.
Our seniors need some meals too, Arthur, while you're on the phone. Mention that.
Okay, I just said.
Thank you very much. And then do you have any reports from council members?
Almost done. Can you hear me?
Yeah.
Yeah,
I'm not
Carol.
gonna get on. I don't.
Maybe he's on the phone.
Is it there?
Carol, why don't you speak on the phone? Why don't you? Oh, Yeah, I hear you. Go ahead.
You can hear me?
Yes.
Okay. I guess I'm too late to speak on any of the items, so.
Do you want to say
You guys-
something? That's time for reports. You can talk on any items now.
but-
Mr. Mayor, question?
Yes. Yes.
Maybe Councilwoman Key should be on a desktop computer that has a more solid connection rather than a wireless with the
Yes. So,
tablet. I'm on my desktop computer, and I've had a little bit of connectivity issues. Maybe if IT would consider getting her on a desktop as opposed to tablet.
I can try that next time, because I'm on the Surface now.
oh, you wasn't on the Surface?
I'm on the Surface, and I've used both my home internet and the Verizon hotspot. It just not working well.
There you go.
Yeah, I hear it. I see you. Yes, Carol, do you want to speak on any of those items before we move forward?
One, I think y'all are moving towards a testing. My only comment on that was I was supporting that. My big concern is that we get our residents tested. And if it's like the lottery, you call in and get an appointment. My concern is our residents aren't going to get tested. We're going to do this. We're going to, expose our city, our police. I didn't get the final number. Yesterday was 41,000. I don't know what the number is, but spending a lot of money where no other cities are really paying for this and not getting our residents tested. If we can get our residents tested, I'm in full support of it. But to test the rest of the county, I have a problem with that. The other thing I was thinking is we should reach out to FIU and see if they won't open a Key Biscayne campus like they did in the South. Maybe we could speak to the state.
Biscayne Bay or Key Biscayne?
They speak to Ron Book. Maybe we can get them to open a testing site like they did in the South. They've got plenty of room to do it. Nothing's going on over there. So those are my ideas.
FIU, Biscayne Bay.
I really want, if we're going to go to this trouble, we need to make sure our residents are getting tested. That's really important. So that was my thought on that.
Councilwoman, I know during, you maybe didn't hear us when we were talking earlier. I did speak with the individual, and we're working on a way to add some stuff there to close the parameters to see if we could just make sure at least a certain percentage of North Miami residents get tested. So I'm going to be working with that on them before we move forward.
Okay, that's important. I mean, there's no sense in going through all this. I mean, this is a tremendous amount of work. Liability, I heard you talking in, and I'm really sorry. I was trying to listen on my iPad, so I got to hear most. But we don't want anybody coming back. And when we start testing and getting people in our city, we don't want coming back. We're not the health department. So, and I'm hearing also there are a lot of these testings that are coming back inconclusive, and they're admitting, well, these tests aren't really working that well. So someone goes, they get tested, and they take all this time to get back to them, and it's wrong or it's inconclusive. Are they going to come back to us and sue us? Are we opening ourselves up for a lawsuit? So let's make sure it's worth it. Let's make sure it's going to take care of our residents, and then I will be on board.
Thank you very much. Do we have any report?
Can I say one other thing?
Yes.
I don't know how you end utility. I'm glad that we're not making any final decision. Let's work with the numbers. But I fully support our manager in deferring any, bills or, payments. We're definitely not going to shut anybody's water off. And my question, I don't even want to get into a discussion, but my comment was, are we going to give a deferral or relief to people that are affected by COVID? Or are we just going to do it for the entire city? A lot of our residents really don't need that extra discount. And some people who don't pay their bills anyway are just going to jump on the bandwagon. So I'm wondering if we can, have some kind of proof that they're been affected by this and that's why they're not paying, not just a way to get out of paying their water bill. So just some thoughts. Thank you.
Thank you.
What?
Yes, Vice Mayor.
Hey, I was going to let Councilwoman Keys know that we did talk about if we run it through the existing program, which there were language that the former manager and finance work, you had to be either up to in need, that's number one. So one of the criteria that they would add in would be you lost your job as a result of COVID or you are been infected by COVID. And I think you have to be up to date or something on your bills. So you can't be like laid off and then because it wouldn't make no sense even with the existing program because some folks owe $3,000. We can't, that's a whole different story. So it is, I think it's for current folks so that we really, really helping them keeping the waters on.
Thank you very much.
Even if they're delinquent.
Yes.
Even if delinquent and it's COVID, I would like to see anybody who's affected by this get a break for this portion.
Thank you very
Guys,
much.
I don't know if you can still hear me, but my camera has stopped working. When Councilman Keats came back on, my camera went out. So if you can hear me, that's fine. I'm just going to sit here silently now.
I hear you. Madam Clerk, do you have any report, anything to add?
Is the council done with their reports? I'm trying to fix it.
Yeah, it's you.
Okay. Sorry, Councilman Gavin, I was trying to see if I could set your camera up, but it does not give me any other.
Don't worry, we're about to adjourn.
Okay. I just, of course, I want to thank city administration, city management, of staff, and all frontline workers for their efforts throughout, this pandemic and just for really keeping our community up and thriving in spite. I know a lot of people, had questions about the fact that we need to now wear face masks when we go out into different buildings, and they're asking about the fact that we don't have face masks available. We do have a resident and employee, Karen Frederick, who's actually hand sewing them, and she's willing to give them out for free to anybody who asks. So you all can either contact Karen Frederick directly or the city clerk's office, and we'll make those connections for you to make sure that North Miami residents do have the face masks they need to be in compliance with our order. Again, the city clerk's office, launched the reemployment applications assistance. And so if you or someone is in need of reemployment assistance forms, you can definitely stop by the city clerk's office. We can send one via email. We can give you the link. There's a variety of ways that we can get the information to you. We can help you fill it out as well. And of course, FedEx is distributing envelopes and actually mailing them off and printing them for free as well. But definitely we aim to always be a resource. They have also launched a new site that is supposed to, take care of all of the problems that existed before. But nevertheless, we're very much happy to walk folks through and get the assistance that they need. And a lot of folks have been asking about the fact that there's a question as to whether our general elections for the entire nation will still be taking place and how people will be voting. Vote by mail forms are available for those who are interested through the city clerk's website, or you can contact the city clerk's office. Our phone number, once again, is 305-895-9817, and you're more than welcome to contact us to get vote by mail forms. And generally any assistance that you think that we can be helpful for, we're happy to make those connections. And that is all I have, Mayor. Thank you.
Thank you very much. City Attorney.
No report, sir.
Thank you very much. City Manager, do you have any report?
No report, sir. I'll be. What, Mr. Mayor?
Thank you very much. Can I hear motion to adjourn?
Wait, Mayor?
I'm gonna be reaching out to you guys to start back rescheduling our our weekly debriefings. So I'm going to have the weekly briefing started back this week. So just be looking out for an invitation, and we'll do it the same way through Web2Go. Thank you.
Thank you very much, Madam Clerk. You are going to say something.
No, I was queuing the city manager.
Oh, okay. Thank you very much. Can I hear a motion to adjourn?
So moved.
Thank you.
Motion made by second. Is there a second?
Scott.
Second,
Oh,
Okay.
second,
Second, Councilwoman Keys, all in favor?
Aye.
aye.
Opposed?
see you in 2 weeks.
All right, adjourned.